This little body is covered with swords. His sister also has marks all over her. We are struggling with hygiene. We don't have cleaning products like shampoo, soap, or sponges. We are living in tents in sand with the insects, overcrowded tent camps, and temporary shelters with no running water. Toilets or sanitation are a breeding ground for the rapid spread of disease. Sewage systems, desalination, plants, and water supply networks have all been destroyed by Israeli attacks or have no fuel to function. Famine has been declared throughout Gaza. Children are particularly vulnerable. Their compromised immune systems can't fight the barrage of germs. They're up against spots are appearing on my son. It's an infection. We're sleeping in the dirt with nowhere to go. It's very tough. Please help us. Please supply us with shampoo, even a bar of soap to wash our children's hands. Hygiene is a luxury. There isn't enough water to drink, let alone wash. Dr. Ahmed Alar heads the pediatric department of Nasser Hospital in Khan Yunis, where the waiting room is packed with people desperate to see him. The reason behind the spread of these bacterial diseases is the complete destruction of the sanitation system. You have groundwater mixing with the sewage. There's the severe overpopulation, the extreme heat, and a lack of ventilation. Gaza is facing a public health emergency for the first time in a quarter of a century. A polio epidemic has been declared. The virus was detected in samples of sewage and wastewater flowing between tents. Israeli attacks have killed more than 16,250 children in nearly 10 months of war. For those who survived the Israeli bullets and bombs, a combination of famine, disease, and displacement compounds their misery. Lawal Jazer Mes Kabalo was the emergencies doctor for the World Health Organization, as well as a medical doctor. He's now Professor Emeritus of Global Health and Humanitarian Affairs at the University of Manchester and joins us live from Geneva. A very warm welcome to you. So what does the fact that these somewhat preventable skin conditions are occurring, what does that say to you about how dire conditions are in Gaza? Well, I think we shouldn't be surprised that we're getting outbreaks of communicable diseases. Polio virus has been detected. We now have a hepatitis recently reported, and there have been epidemics of, for example, respiratory infections and skin infections, and these are a combination of what your correspondent was saying: lack of hygiene, water, sanitation, and breakdown of public health services. Now, if you go by the experience of other wars and conflicts like Syria or Afghanistan or Yemen, for every person who dies or is injured by a bullet or a bomb, you can say that about 3 times that number will get sick or indeed die from preventable communicable diseases. And all these factors are coming together now as a logical legacy of the past several months of the conflict that